CARE stands for Community Advocacy Resident Education. And as pediatric residents, we have this tremendous opportunity to participate in community advocacy. We first do this in our intern year, so our first year as pediatric residents, through the PLC, or Pediatric Links to the Community program, where we spend 2 weeks and we get to spend time in the community seeing what's out there for the children that we take care of in our clinics. Then as a second year, we get to choose whether we want to participate in a specific track designed to focus more on this community advocacy, and this is the CARE track. Essentially, is a twofold method at this point in time. The first aspect of the program is a menu of services that, along with my collaborators at the Children's Center, we have developed. This menu right now contains 13 different community resources or community services that are available to families, including things like WIC or HEAP or mental health services for children or family planning services. And parents may look at this menu, and it's presented at each intake into the Children's Center, and then they can decide whether or not that they feel any of these services would be helpful and useful in their families. If they do think that these services would be beneficial, then the parents can then link with the service right there on site. And this brings us to the second part of the project, which we have a community health nurse right there on site at the Children's Center who works to facilitate and really hook families up with these services. So she's there to help fill out applications, she's there to set up appointments, she's there to give them any of the necessary information that they might need to really be able to bridge the gap between the family and the service that they think would be helpful in their time of need. Very fortunate to have been able to collaborate and partner with Dr. Ken McConaughey and Nancy Wood from the Healthy Access. And they have their, Healthy Access is here based out of the University of Rochester Medical Center. And they have other sites throughout the community, mostly in the daycare setting, where they're really able to help decrease the stress in families' lives by providing on-site visits for acute illness kinds of needs. And they have graciously given of their equipment and given of their time to be able to train not only our community health nurse, but 2 of the child center's staff as well to be able to do telemedicine. And this is huge for a couple of reasons. One of the reasons that it's so big is because really these families have already taken time out probably of work to come to court in the first place. So to expect them to then take an additional day or additional time to go to the child's pediatrician if they're ill would just be a lot to ask of them in general. And so this allows their child to be seen by a physician while they're right there at the courthouse. And the goal is not to make the courthouse a health clinic per se, but really, again, to bridge these children to their pediatrician or to a medical home. And then, to help these families feel like we can support them in this way and that they may not have to then use the emergency department for these kinds of visits.